Welcome back. And right when we were on the break, you brought up a very, very good point about getting your oxygen levels up and getting that rest so you can heal.
Yeah.
And so many people want to take a medication to help them sleep through their pain, but in reality, that's actually sometimes delaying their healing. And I think that's a very good point for you, the public, to know that pain pills are not really always the answer, and it is a dead-end road. So, hey, we are fortunate enough to have Chuck calling in. Chuck.
Hey, Doc. Thank you. I had the privilege of stopping in and seeing the Wellness Center last week, and Dr. Christensen was nice enough to give me a whole lot of his time, and I am so impressed with what it is already and what it's going to be.
Thank you, Chuck.
And I can't tell you how much the entire healthcare system needs places like this.
Yep.
I just wanted to put in a plug also for a series called Truth About Cancer. And it's about 14 or 15 hours of videotape time, a DVD. And the vast majority of the people that speak are either doctors, oncologists, nutritionists, chiropractors, etc. And they go through the whole gamut of cancer. And, of course, it applies to wellness in general, but it is so incredibly comprehensive. And even though they, like we all do, point out the issues with Big Pharma and the system, it is a very positive series, and I recommend it for everybody. You can get it at truthaboutcancer.com.
Okay.
And at any rate, my question for you, Dr. Reiner, is going back a couple weeks ago, I told you about my diarrhea issue. And I'd had it, for a month. Now it's at 6 weeks. And I saw my doctor, who's Dr. Van Wagner. And she's put me on medication. I had my gallbladder taken out, and she thinks it's related to that. And it's called cholestyramine light. Did I say it right?
It's cholestyramine resin.
Okay. And I know there's an issue with the absorption of other medication, and I was wondering if you'd kind of talk to me about that.
Okay.
I take a lot for my cardiac issues, and I don't want it to interfere with the the pills I'm taking, the medication.
Sure.
So thanks a lot, Doc.
You bet. So post-cholecystectomy, removing a gallbladder, diarrhea is pretty common because you can't really, usually when you eat, you basically have a gallbladder that secretes bile acids, and the bile acids break up the fat. So a lot of times when you don't have an active gallbladder that secretes, you basically can't absorb the fat as well, and the fat acts like a cathartic, and it helps the diarrhea. So what cholestyramine was actually a cholesterol binding agent, okay? Because a lot of the bile in the bile has a lot of cholesterol in it, and we reabsorb that in the terminal part of our intestine, which is where some of the drugs like Zetia work to block that reabsorption of cholesterol. So basically what they were giving him, the reason they stopped it was because in the elderly people, it actually was blocking them up. It actually was creating a log jam in their colon. They were obstructing, and people unfortunately had to have surgery, and they also basically, some people died. So it obviously came out with new poisons, some of the statins and some of the other drugs, but the cholestyramine resin is basically used in his case to basically help absorb some of the fat and adding some bulk to the stool and absorbing some of the bile acid sequestrant, so it actually absorbs some of those things. So it actually will help that. Whether or not it will help or not, Chuck, I guess remains to be determined, and nobody will know. But be careful of the rebound of the side where you basically take too much and then you get constipated. So it's very important that you watch on that side too. So go very slowly, increase it. That would be my thing, and do that. So so we have another caller, Louis. Louis.
Hey, Doc, how you doing? This is Louis DeCanio.
How you doing, Louis?
Okay, listen, I got a question.
Yep.
As us guys get a little older and stuff, when we, have a drink or some coffee or something, sometimes it runs through us pretty fast and stuff. Is there some way to slow down that process? Because sometimes, like, if you're traveling or something and you have like a drink in the car or something, sometimes we got to get out and water the flowers a little bit. So, is there some way that we can like lengthen that time? That's my question. Okay, thanks a lot.
You're welcome. I guess the only way I would think you'd be able to do that is to dehydrate yourself before you had coffee. But coffee, caffeine, obviously, is a diuretic. And it's a methylxanthine, and it depends on how hydrated you are and how much fluid you've got in your system. So that's how well it works. So decaffeinated coffee might help, but then again, you don't get the jolt in the morning that some people need. So, and it depends how much you drink too. I mean, some people like to have a glass of water. They have orange juice. They have all that stuff. So they're gonna do that. So, yeah, I guess that's a problem. You gotta pay for everything you do, right?
Yeah.
No, I love a good cup of coffee in the morning. And there's a lot of things that come up about coffee. I think for people with COPD, it helps their breathing. And there used to be a drug called theophylline that was out, and theophylline was basically a drug that they thought opened up the airways, but it really didn't. What it did was it increased diaphragmatic muscular contraction. So that helped people breathe because they could breathe stronger. But caffeine is a stimulant, and actually I had a patient in today who had his blood pressure into the 170s for a period of time, and he couldn't find his decaffeinated coffee. And when he was taking some medication for that, and then when he basically figured out that he was drinking caffeine-related coffee and went back to decaf, his blood pressure tended to come back into control. So when you're checking blood pressures, make sure that you don't have a cup of coffee within an hour before that, because your blood pressures will be erroneously elevated, and that could be a problem for you. So do you do blood pressures at your office?
Yeah, we do blood pressures. We do the physicals for the kids here in town, and it's interesting because they'll come in and I'll do a BP on an athlete that's in pretty good shape. Usually, a 15, 16-year-old kid, you're looking at 110 over 70, and that because they're running and they're doing stuff. And if they come in and they're 130 over 85 or 87, I always ask them, did you have a cup of coffee or did you drink a Coke before you come in? And the answer,
now the Monster drinks.
And the Monster drinks, the answer is, oh yeah. It's like, well,
yeah,
that's why you're high.
Yeah, yeah. And so any caffeinated related beverages, if you smoke, if you have a cigarette within an hour of taking your blood pressure, that's going to elevate it. If you eat within an hour of taking your blood pressure, it's going to elevate it.
People in pain.
Yeah,
their blood pressure is always high.
Absolutely, people in pain. One of the things that's kind of interesting, I see this a lot and I hear it a lot, nosebleeds.
Yeah.
People think that that they get high blood pressure and their nose bleeds.
Mm-hmm.
Well, really what it is, it's very, very, it's unsettling would be the word, when your blood is pouring out of an orifice of your body.
Yeah.
So that's what's causing the blood pressure, as opposed to the blood pressure causing the bleed. What causes epistaxis or nasal bleeds are basically two causes. In a younger person, it's going to be what they call erosions or dryness at the place where the nasal septum meets the tissue or the bone, and that's called Kesselbeck's plexus, and it's actually a 3-vessel conglomerate that comes together. When you're older, in the 60s and 70s, we get some bleeds, and they are posterior bleeds. They're actually further back, and those can be very, very dangerous, and you can actually die from those. So those need to be treated very aggressively. So if you're a 60, 70-year-old And especially if you're on a blood thinner and you get you don't really get anterior bleeds, you get posterior bleeds, you need to get down to the hospital quickly and get that looked into, because that could be a devastating situation. And blood pressure is not the cause of that. In fact, very interesting, blood pressure actually constricts blood vessels. So that being said, it doesn't make sense that it causes the bleed. And then when it comes to blood pressure and strokes, you know, there's several different types of strokes, but the ones that I've seen a lot of lately are what they call lacunar infarcts, okay, where you actually get persistent high blood pressure and the blood vessel narrows like it would do in your lungs. It would tighten up, and as it continues to tighten up, it actually cuts off the circulation to the area that it's trying to feed. And so that's why it's so important to control your blood pressure and to get that checked periodically. And understand the dynamics of blood pressure so that you're not checking it at the wrong particular time. And I do not subscribe to using the cuff.
wrist,
Yeah, the wrist. It's just too far, too many things. If you hang your, you know, you're supposed to elevate it at heart
Level
level.
of your heart, yeah.
The left side should be greater than the right because it's actually closer to that. But when you're checking your blood pressure, I would use the device that's on the arm. Bring it into your office, your provider, you or me, and do a gold standard. Have someone, you know, listen to it, have you do it, but actually wait in between, because once you check your blood pressure, if you don't wait, you sent the blood vessel into a spasm. So it's very important that you rest comfortably and wait a minute before you recheck that blood pressure to give it a chance to get back down. So, hey, we thank all the callers. I know there's other people out there watching. We're going to go to break. That'll give you enough time to think about a question for the last 15 minutes. Thanks.